me to stop something, to stop a bad habit. If you want me to stop a bad habit, how would you say it? How would you say it as a communication? Sorry? Yes, will you be able to do that? Can you do that? So meaning, guys, you cannot just force something on a patient. Well, smoking is bad for your health. You are having heart problems because of smoking. Well, I want you to stop smoking. Can we talk like this? No. Mr. Alex, you presented today because of a chest pain. One of the main reasons why you had such pain is because of smoking. So smoking is affecting your health. So I'm giving him a reason, yeah? So is it okay? Would it be doable for you? Would it be something that you can do if you stop? What do you think about it? Does that make sense, guys? But not giving him instruction and giving it him as an order. No, because you cannot force him to stop smoking. So hence, you need to give him a reason. You need to give him the relationship between smoking and heart, and then you need to ask his permission. Would that something you can do? Can you do that? That is in terms of communication, guys. I'm talking to you about communication. Why? Because if you go to the exam and you talk to the patient and in a robotic way, order, instruction, you will not pass the station because you do not have good communication. Even if the medicine you are saying is right, even if it's correct, but if you don't have good communication, you will never pass. Guys, do you get my point? So, quickly. So, to come to UK, to get the license in UK, how many steps? 3 steps. Step 1 is IELTS or OET. We highly advise you to do OET because it is easier, called occupational English test, guys. Very easy exam. If you are a doctor, it's easy because it's talking about discussing about the patient and listening to a condition and occupational. But IELTS, very difficult. I'm telling you, some people do pass it, but it's not easy. Okay? OET. After you pass OET, make sure the validity is how many years? 2 years validity. So you have to finish all your exams within 2 years. After you finish it, what is step 1? What is the exam about? MCQ. How many questions? 180. Okay, do you need to go through textbooks? Guys, by the way, passing the exam, specifically this exam, is not difficult. Guys, listen to me. You know why it's not difficult? Because it's all about the recalls. It's all about the previous exam tests, and they have a certain question bank. We know all about it. We give it to you. You go to the exam, you pass the exam. Hence, people when they say, "Oh, the license to work in UK, it's gonna be tough." No, it's all recalls. So with the PLAB 1 or UKMLA step 1, we will basically, you will study certain questions and the exam is from those questions. UKMLA step 2, we said, what is the exam about? Is it written exam? Is it OSCE exam? Is it what? What is the exam about? OSCE. What is the meaning of OSCE? Sorry? That's a simulation. You and patient. How many OSCEs? 16. How many minutes do we give you for the OSCE? 8 minutes inside, 1.5 outside to read the question and prepare yourself, okay? The 8 minutes inside, divided how? How is it divided, the 8 minutes? I mean the station, the scenario, the marks, how is it divided? 3 domains. Domain number 1, history taking. How many marks? Domain number 2, management, 4. Domain number 3, communication, 4. But I told you, watch out, very important, communication skills. Guys, communication skills. If you are very good in management, very good in history, but you don't know how to communicate well, trust me, you will fail the station. So, it's a mix of medical knowledge and communication. And in Egypt, that's where I'm from, yeah? In Egypt, we do not know how to communicate with the patient. In Egypt, that's what we do. Mr. Alex, this medication is good for you. This is for blood pressure, okay? Thank you very much. Doctor, but why? It's good, okay? What if doctor, what if it doesn't work? Don't worry, come back again. You know, we don't have time for the patient. But in UK, no. In UK, It's all about how you communicate and how you talk. Mr. Alex, you came today because of high blood pressure. Because of many ways, Mr. Alex, to manage high blood pressure. One of them is lifestyle. One of them is lifestyle. So, Mr. Alex, you told me that you smoke cigarette. Yes, doctor. Well, cigarette can lead to high blood pressure, and it's really a risky factor. So, Mr. Alex, can you do this? Can you try to stop cigarette, smoking cigarette? Well, doctor, I can't stop cigarette. Is there any reason why? Well, doctor, because it relieves my stress. Well, I really appreciate that, okay? Well, there are many ways, Mr. Alex, where you can relieve your stress. What do you think of trying this or trying this? So do you see how, guys, do you see? But if you say the same content, but without good communication, if you say to him, stop smoking, smoking is not good for you, but you come across as you are giving instructions, you are giving them orders, you will fail the station, even though the content is the same. The content. So basically, if you ask me, Dr. Mo, what is the factor that causes the failure in these exams? The factor that actually causes the failure, the factor that filter candidates from each other. What is the factor?